Have you ever just wondered how in the world doctors remember every single bone, muscle, and nerve in the human body? Well, today we're going to hack the system. We're diving deep into the seriously complex machinery of your lower limbs. And we're going to do it by uncovering the ingenious shortcuts and memory tricks that medical students used to conquer this monumental task. All right, let's jump in. First things first, let's just set the stage here. Learning anatomy is hard, like really, really hard. It's not just about knowing a few key parts. It's about memorizing this massive, interconnected web of names, locations, functions, and relationships. It is, without a doubt, a huge challenge for any student. And hey, don't just take my word for it. The authors of our source material put it perfectly. They say the sheer content burden can be so overwhelming that it actually risks killing the very fascination that draws people to medicine in the first place. You know, the big, beautiful picture gets totally lost in all the tiny details.
So that really brings us to the big question, doesn't it? When you're faced with this mountain of information, how do you make it stick? How do you turn a long list of Latin names into a landscape you can actually navigate in your mind? Well, it turns out you start by looking for a secret door.
This is where the real genius of anatomical learning kicks in. It's all about reframing the body, not as some textbook you have to memorize, but as a real, physical space with its own geography, complete with shortcuts, landmarks, and yeah, even secret passages. So let's zoom in on the pelvis for a second. See those two thick bands of tissue? Those are the sacrospinous and sacrotuberous ligaments. Now, they're not just there to hold things together. The way they're arranged actually forms this critical opening, a passageway called the greater sciatic foramen. And believe me, this isn't just any old hole. It's a super important piece of our body's architecture. And this is the hack. This is so brilliant. Medical students don't just see a foramen, a hole. They see a door to the gluteal region. It's the main highway for all the important nerves and muscles to get from inside the pelvis out to the back of your hip. By giving it a simple, functional name, a door, a really complex anatomical relationship becomes instantly unforgettable. Okay, so thinking in metaphors is one really powerful tool. But the ultimate secret weapon in a medical student's arsenal? It's a special kind of memory aid, one designed to organize even the most ridiculously complex information. Let's take a look at how these memory hacks help build a mental map of the body. We are talking about mnemonics. I'm sure you've used them before, like Roy G. Biv for the colors of the rainbow. They're just simple patterns or associations that help your brain lock in and retrieve information way more efficiently than just trying to memorize it by brute force. Now check this out. A single word can map out an entire region of your body. Let's take the femoral triangle. It's this super important area in your upper thigh. To remember its boundaries, students just use the simple word sail. S is for the sartorius muscle, A is for the adductor longus muscle, and IL stands for the inguinal ligament. And just like that, you have a mental blueprint of this crucial space. And it is crucial. It's the major hub for the artery, vein, and nerve supplying your entire leg. But wait, it gets even more clever. Take the mnemonic Sergeant Vote. At first glance, it just sounds like a name, right? But it links three specific muscles that all meet up near the knee, the sartorius, gracilis, and semitendinosus, to the exact nerves that control them, the femoral, obturator, and tibial nerves. And here's the really brilliant part. The order is perfectly aligned. S goes with F, G goes with O, and T goes with T. It's a perfectly organized list hidden inside a name, and that is absolutely invaluable when a doctor needs to figure out which nerve is damaged just by seeing which muscle isn't working right. Of course, these aren't just tricks to pass a test. Knowing this anatomy inside and out has real life or death consequences. This knowledge becomes absolutely critical when things go wrong, connecting that abstract map of the body to real-world trauma and treatment. Just imagine this scenario for a second. You're driving and you have to slam on the brakes. In that split second, to get your foot from the gas to the brake, your body puts your hip into a very specific position. It's flexed because you're sitting, and your thigh pulls inward and rotates toward the center of your body as you pivot. Now take a look at this X-ray. That exact braking position is biomechanically really unstable. So if an impact happens, the force shoots right up your thigh bone and can easily pop the head of the femur right out of its socket, backwards. This is a classic dashboard injury, and understanding that specific anatomical position is the key to diagnosing it fast. And this knowledge isn't just about fixing injuries, it's about preventing them too. When a nurse gives you a shot in the gluteal muscle, they're not just picking a random spot. They're carefully targeting the upper outer quadrant, that safe zone you see highlighted here. Why?
to avoid hitting the massive sciatic nerve that runs right through that area. A misplaced needle could cause unbelievable pain and even long-term nerve damage. Okay, so beyond the high-stakes clinical world, our anatomy is also just packed with incredible and sometimes kind of quirky stories. So let's finish up with a few rapid-fire facts that show just how fascinating our lower limbs can be. First up, remember that sartorius muscle from our sail mnemonic? Well, it actually has a nickname, the honeymoon muscle. Why? Because it's one of the main muscles that lets you cross your legs, pulling the thigh out and rotating it. It's just a fun little piece of trivia that makes the muscle instantly more memorable, right? And speaking of key muscles, let's talk about the gluteus maximus. It's not just the body's biggest muscle, it's an absolute powerhouse that extends the hip. It's what lets us run, jump, and perform these incredibly powerful and elegant movements, like the arabesque you see here. It is truly the engine of our lower body. But it's not just our muscles that have stories to tell. For a really stark contrast, think about the femur, the long bone in your thigh. It is the strongest bone in your body. So strong, in fact, that our source material points out some New Guinea warriors historically carved them into exceptionally strong and fierce daggers. The very same bone that supports our every graceful step has also been a tool of conflict. From secret doorways and clever mnemonics to clinical dramas and surprising histories, every single part of you tells a story. And we've only just scratched the surface of the lower limb. So the real question isn't just what you've learned today, but what these stories make you want to learn next.